Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Thank you for joining our webinar. We are going to wait a couple of seconds so that people can start joining the website. All right. Well, thank you again for joining today's webinar, which is entitled Breaking Down Silos, Collaborative Research to Inform City of Austin Food System Response During COVID-19. My name is Sandra Vandenberg, and I am faculty at the UT School of Public Health and also the Associate Director for the Michael and Susan Dell Center for Healthy Living. And our center is hosting today's webinar. Before we get started, I just wanted to make some housekeeping announcements. First of all, this webinar is being recorded and will be archived along with the presentation slides at our website at msdcenter.org. And if you have any questions during the presentations, because we have multiple speakers, I think it would be best to just place your questions into the chat box, and then we'll have some time at the end for Q&A. And so today, I will start by introducing the speakers. So we can go to the next slide, please. We have, first of all, we'll start out with Amanda. So Amanda Rolick is Food System Advisor at the Office of Sustainability at the City of Austin. She'll be followed by Katie Jonda, who is a postdoctoral fellow at the UT School of Public Health, and she's an NCI Cancer Control Research Training Program fellow. Then she will be followed by Casey Hansen, who is a program manager, the Division of Community Engagement and Health Equity at the Dell Medical School. At the end, after the three presentations, I will be leading the Q&A session for this webinar. And we'll just start off with Amanda. So Amanda, give it to you.
Awesome. Thank you so much, Sandra. Thanks everyone for joining us today. So my job is to just kind of give a little bit of overview, and if you'll advance the next slide, a little overview of how we got here and sort of the ask and the need here. So starting back in February of 2020, which seems like many lifetimes ago, I know some of you are watching from here in Central Texas, and that was sort of the start of when COVID became really real for us locally, and the City of Austin and Travis County stood up the Emergency Operations Center to respond to the COVID-19 pandemic in an attempt to control the infection rate and respond and coordinate around the crisis. So as part of that response, the Food Access Task Force was created and is headed up by our office. Again, I'm in the Office of Sustainability at the City of Austin. And we have been working in collaboration with many other city and county departments, in addition to a really vast network of external stakeholders, including researchers and direct service providers that are responsible for much of that frontline food access work. As part of our coordination, we have representatives from the local independent school districts, charter schools, private schools, the Central Texas Food Bank, food rescue organizations, homeless service providers, faith-based groups, volunteers, and many, many more. And we meet weekly to discuss pressing issues, identify any unmet needs that folks are seeing, and ensure that the most vulnerable folks in our community have access to adequate, nutritious food. In the beginning of COVID, we were meeting much more regularly, I think twice, sometimes even 3 times a week, but we scaled back to once a week. Since then, we have also had another emergency response to Winter Storm Uri. So we kind of upped those meetings again during that time. But this framework of sort of having a central group get together to discuss kind of the current landscape has proved really helpful. Next slide, please. So in the early days of the response, the landscape was shifting so quickly. There was a decrease in the efficiency in getting people fed due to all of the traditional models that we know, like congregate feeding, kind of no longer being a safe or viable option. We also saw, the stay-at-home orders hit, which impacted families and individuals significantly. They came into effect and people, had to stay home from work for weeks, months, so lost wages. They were having to cover meals for families that had previously been covered through free and reduced price meals through their schools. And on top of that, all of that, we saw many organizations lose some of their core volunteer base, which we know in some situations tend to be older, retired individuals, and those we know who can be particularly vulnerable to COVID. And those folks were choosing to stay home, reducing their risk of exposure. So we even saw some emergency feeding locations temporarily close. We quickly realized we needed more information about our local food needs landscape to help guide us on how and where to allocate limited resources and inform our food access planning as part of the ongoing pandemic response. So essentially, we needed to know where there were unmet food needs in the community and how we could quickly deploy resources, new resources, or engage partners that had been doing this work, or find new partners to help address those needs. Through our coordination calls, we had a lot of information coming into us about, what people were seeing, what was happening with the folks that they served, a lot of personal accounts shared by network partners of what they were seeing happening with their clients. But we, as kind of the two people who were heading up this food access task force, did not have the capacity to roll that information up and address what we were hearing in a strategic and coordinated way. This is back in the first weeks and months of responding to the pandemic, and we were working, regularly, kind of these 12 to 15-hour work days, and we just did not have the bandwidth, the time to dive into research and data collection that we needed to inform our response. So we needed to act quickly, and we needed to tap into our network and leverage the power of our partners. Next slide. And that is where the other panelists come in and our partners. So city staff coordinates and works regularly with UT School of Public Health and Dell Medical School Division of Community Engagement and Health Equity through the Austin-Travis County Food Policy Board. We also work with them through our Fresh for Less mobile market program and the corresponding evaluations around those programs, and so many more touch points. So we also knew that the Division of Community Engagement and Health Equity had been working on their household level assessment and had been working with Austin Public Health on contact tracing. And so we thought, how might we leverage some of the existing community touch points and engagement that was already happening, and some of the data collection that may already be happening through our partners, like the United Way 211 call line, and see if we could dig into that to better understand what was happening from a food access perspective. So now I'm going to pass it off to our partners to explain some of the details of how they stepped into this work, starting with Dr. Katie Janda explaining her work analyzing the 211 call data.
Thanks, Amanda. So yes, I'll be talking about pivoting to identifying areas with unmet food needs during using 211 call data during the pandemic. Next slide, please, Kate. Thank you. So a little bit of background on using 211 call data. We had previously at this UT School of Public Health had been working in collaboration with the United Way for Greater Austin and their 211 call navigation program. For those of you who are not super familiar with 211, 211 is a resource hotline that one can call, and it will connect connect callers to resources in their area. So they'll ask for your zip code and a variety of demographic information that I'll explain a little bit later, and try to make sure that they are connecting you to the resources that you need, and it can be multiple resources that are located close to you. They'll also have, you can call 211 if you have a benefits question, and that can they'll transfer you over to the State Health and Human Services Department. So you can have some benefit-specific calls and needs answered that way. So I previously had experience using 2018 211 call data to identify areas with food needs and limited geographic food access in the Central Texas region, so 10 counties that kind of surround the Austin area and are the United Way for Greater Austin service area. Next slide. So the purpose of the analysis was to identify areas with unmet food needs due to COVID-19 specifically, and take all of that experience I had utilizing the 2018 call data and hone in and focus on Travis County, and to share this information with collaborators and other stakeholders, thus creating kind of a feedback loop where we would share data and information with the United Way, of course, as well as City of Austin and Dell Medical School, our other colleagues on this panel, to identify these areas with unmet food needs, and then therefore inform some of the future research and strategies to alleviate food insecurity during the pandemic. This is critically important to have this local level data, because we know food insecurity prevalence is rarely in real time. Typically, if you're familiar with this work, you might get prevalence rates from a couple of years ago. So for instance, especially at the local level. So the closest data that we have at a zip code level or a census tract level is actually from 2018 from the American Community Survey. So it's really important to have this real-time kind of methodology to fill in some of those gaps. The food access locations were also provided by United Way and collaborators at the City of Austin, who were able to give us that information, and that way we could kind of triangulate some of the data. So through this, we were able to analyze data from January to August, and as well as October and November 2020, as well as January to August and October to November 2019. So the reason why September is missing is because there were some fluctuations with the call line service that was being updated. So some of the actual data about the calls that were received in September weren't tracked appropriately. So we didn't want to misrepresent the data that we were given. So that's why September is excluded from this analysis. But by providing months prior to the COVID-19 pandemic, as well as so January through February 2020 within Central Texas, as well as those 2019 dates, you're able to kind of compare and make sure that you're not taking things out of context and having the best sort of reference when looking at these data. We also looked at data by call reason, and as well as zip code, and then those food access locations that I mentioned previously, as well. And then there was some limited demographic data. So 211 is not about race ethnicity, and this isn't an oversight by United Way, but it's actually decided by the Health and Human Services Commission for the state, and trying to make sure that there isn't any type of allegation that there's discriminatory practices by the in the lack or ability to refer people to resources. So unfortunately, we don't have that race ethnicity data, but it's at least a starting point that we're able to use these data to identify these needs. So next slide. So looking at food calls to 211 by month, you'll see in this graph January through August, and then October and November call data. You'll see the call data for food needs from 2019 in a lighter blue, and in 2020 in a darker blue. So you'll see that there were more food-related calls to 211 in every single month in 2020 than in 2019. However, in January and February, that difference is pretty negligible, but then as you get to March, it increases quite a bit. In April, it more than triples. And then in May, it's consistently high, and then you see another peak in October. So the spike in April 2020 was largely due to calls that were transferred from 211 to Health and Human Services about those benefits calls I mentioned earlier, and specifically were many calls regarding SNAP benefits. In May 2020, you can see that over 2 times the food need call volume from was there than from May 2019, and then in June it's about 1.5 times the overall call volume, and June 2020 than June 2019. And that's about the same differential in October and November 2020 than October and November 2019, respectively. So the most common reasons in general for calling 211 were actually about food in the months of April, May, July, August, October, and November in 2020. This is a big contrast because normally health and mental health issues and reasons and justifications are the predominant reason for calling 211 in 2019. Next slide. So to summarize some of the geographic analysis findings, the call volume was highest in the eastern crescent of Travis County, which I'll discuss a little bit more with maps in a second. And that's for overall call volume, so call volume to 211 about any need, as well as food need call volume. And this is somewhat expected given 2018 American Community Survey data, where with a map I'll present in a second, you can see that this region of the county is predominantly lower income, also has greater racial ethnic diversity. And given the disparities that we see in food insecurity by income and racial ethnic differences or disparities, we can see why that could be the case. And then also we developed maps depicting the proportion of food need calls to 211 by zip code, and the location of food assets were also created in each of these maps as well as the subsequent reports. Next slide. So here is a map of Travis County presenting the 2018 American Community Survey data. So the zip codes that are in blue demonstrate median incomes under $70,000. The hash marks are for predominantly zip codes where it's a majority people of color that reside there. And then also the dots are poverty rates over 15%. So you can see all of these factors that are associated with food insecurity disparities and also are the ramifications of historic and systemic racism such as redlining practices, et cetera, are all kind of in that eastern crescent of Travis County. Next slide. So here you will see one of the maps that we created for our most recently developed report, which was on November 2020 call data. So you can see that the proportion of calls made to 211 from that zip code are about food needs are represented in different colors. So you can see that the orange is about over 30 to 45% of the calls to 211 were about food needs. The scarlet's more 45 to 60%, and that deep red's over 60%. Again, you can see that this over 30% threshold is really making up that same eastern crescent within the county. And I think it's really important to note that while there are some kind of fringe codes that have higher higher proportion of food need calls, they tend to have lower call volume than this overall eastern crescent area. Also, these little black dots are the locations of those food assets that were open in November 2020. So what's particularly alarming is when you see zip codes in these orange and dark red colors that do not have a food asset or have perhaps fewer food assets than could meet demand located within the zip code. Next slide. So to talk a little bit more about deliverables and the research and how that translates into policy and practice, we've created reports for each month that we've analyzed data and shared those reports with City of Austin, United Way for Greater Austin, Dell Medical School, and other collaborators. Within each of these reports, we provide recommendations, and specifically in the earlier reports, we identified 2 specific zip codes that had a very high overall food need call volume, as well as a high proportion of food need calls located within the zip code, and a lack of a emergency food asset present within that zip code. And we also, as we kind of continued our analyses, suggested other zip codes that should be closely monitored and additional analyses as having potential unmet food needs. And one zip code that we identified of one of those 2 aforementioned zip codes ended up receiving an asset in September 2020. So this ultimately resulted in a rapid research to policy translation. And by sharing these reports, we're able to work and collaborate with our partners, such as Casey Hansen, who will take it over from here. So next slide.
Thanks, Katie. So I thought I'd start with this slide, just to kind of give you an idea of the context in which we come to this work. Normally, we are more so assessing people's needs with regards to equity. If you look at the picture on the left-hand side of your screen, you'll notice that there are people who are in need of food, and yet they're probably given the same level of resources. And so this is just a picture that shows that clearly equality does not equal equity. What we found during the beginning of the pandemic is the question as to whether or not we really were starting more so with the right-hand side of the picture, whereas we felt like there were people who probably did have access, but because of the pandemic, they might be moving towards the left. And so that's really kind of how we came to the Central Texas Check-in. Next slide, please. So as Amanda mentioned, we were starting to do our work in the spring of 2020 to do what we consider to be a 2.0 of our household level assessment. And a little bit about the household level assessment, which we affectionately call OLA. It's an assessment that we do in folks' homes, but in a specific geographic area. So we started this work in 2018. We picked 2 neighborhoods that were actually close to physical, brick and mortar clinics, because we felt like we wanted to reach out to people to assess their health, but also social determinants, but we wanted to make sure we could refer them to a provider. And so, as I mentioned, we go in people's homes, collect initial data, and then we continue to follow up with them in order to provide resources, but then also just to establish rapport so that folks feel like that we're a trusted source and a bridge to resources. We also conduct follow-ups and we check in with them, really annually. So like I said, we started this work in 2018, In 2020, we were planning on doing 2.0, had IRB approved, and of course, we all got shut down. So this work was really we were in a unique situation because we really were getting ready to go into people's homes and start doing some assessments. Next slide. So the first thing that we were asked to do, as Amanda mentioned, was actually assist with contact tracing. So Austin Public Health asked for Dell Medical School, all hands on deck. Folks could pivot what they were doing and help them out with doing contact tracing. And some of my colleagues in even my division in the department stepped up to do that work. But again, since we were ready to do the household level assessment, we thought our bread and butter is really, being that bridge. We need to check in on people, make sure that they have what they need. And to Katie's point, 211 is a great resource, but we also knew that there were going to be folks who wouldn't know about 211. They wouldn't even know to call. And so because we had relationships with people already in the community, we started making calls to kind of get a new version of our OLA with our OLA participants. And that then allowed for us to stand up our COVID work. The way that the COVID check-in worked was once folks were identified as being COVID positive, they went into the contact tracing unit, if you will, and then they had the option to call us. And then we did our check-in, survey tool with them, and then again applied those same OLA processes of, collecting the data, doing follow-ups via phone, and then referring them to resources. Next slide. So I want to share a little bit about the Central Texas Check-in and just kind of give you the lay of the land. It wound up being an online survey tool. We did conduct it in English and Spanish. There were about 43 questions. If someone, there were lots of skip patterns, about 71 variables if you account for the headers and the instructions. If folks needed to know where to go get testing, we provided that information in the survey. So they didn't have to reach out to us and we didn't have to follow up immediately with them. We did, as Amanda mentioned, and actually Katie did as well, we had some priority populations. And so those were folks who were experiencing homelessness, folks age 65 and up. We also wanted to talk with folks who might have some pre-existing conditions, and that even included pregnancy, so clearly folks who had, lung issues or cardiovascular disease, folks even possibly in that obesity category. So these were suggestions from Austin Public Health that we wanted to hone in on these populations. But we also wanted to reach out to folks in the Eastern Crescent because we knew that there were going to be less of those black dots, as Katie just showed you, less food access points. And then furthermore, you've got a population of people who may not even be able to get into stores for various reasons. So we did target some specific zip codes, and I'm going to show you a little bit data here in a bit. But the issue was that we wanted to make sure that we were reaching people who we felt like may have had some of those boxes taken away from that first picture. Those zip codes included those in the Eastern Crescent. And for those of you who aren't as familiar with that, the reason why it's a crescent is that there are a couple of zip codes that cross west of I-35. And so those would be like I think it's 4-5 and 5-8 in the north. So 4-5 is in the south. And then those zip codes that really kind of run almost parallel to I-35, just going all the way down to the southern corridor. The way that we distributed our survey was via our community partners. And we just felt like that was going to be the best way. Given the circumstance, we wanted folks to get something from someone they trusted and not from UT or Dell Med, a stranger. We also recognize that folks aren't going to necessarily just hand over their contact information or contact lists, if you will. So we felt like that was going to be the best methodology, and we just let them know what parts of town we were considering, and then who we were trying to reach as those priority populations. We did have 2 collection periods. Part of our city work was not only to do this check-in, but also to do a scan of the data that had been collected thus far. So in addition to Katie's work, we also reached out to a couple of organizations who we knew were doing surveys. So Measure, GABA, and we did not want to interfere with those survey collections. So we had 2 periods of time that we opened up our survey in order to have our partners push it out. And then last but not least, we did cover a little more than food access. So we did want to know, kind of what people's healthcare situation was, how they were faring with employment, and then also their housing situation. Next slide. So I'm just going to show you just some preliminary data. And I've got a couple of slides or figures that I'll show you here momentarily. But the results that we found that the greatest needs were cash, food, and PPE. Time and time again, we did ask one question regarding, what needs do you have at this time? And so people could select more than one. We also recognized that there were some co-occurring needs. So there were things that, people were saying that they all needed together. And so it's not that people were just saying, I have one need, but they would say they had 3, and those 3 were very similar. And then one of the things that we noticed too was that there was this cycle, and that's why they have the dominoes there, is that oftentimes if folks in the household were diagnosed, COVID positive, there was this domino effect, which meant that no one in the household could go to work, which meant less cash flow. People missed payments of various kinds. And then clearly going back into the workforce meant additional exposure, and then another negative outcome could be evictions. And so this was just the story that we heard in the data that we were collecting. Next slide. Click again. I'm just going to do these graphs here. So the first thing that I wanted to show you all is that we were able with our partners to reach the audience that we were desiring. So many of the other surveys that folks had done, they pushed it out, but unfortunately, based on the networks that they had, they'd primarily gotten a white population, and that's not bad. We just wanted to get others, and so we wanted our data to be complementary to what everyone else was doing as well. And so we were very strategic about the partners that we asked in order to help us push out the survey. So you'll notice there, the Latinx group is that first column, and then all the way at the very end are those who did not provide us with any race ethnicity data. You'll notice also, and this is just a segue to what's coming next, but we did have, a very small population, a little over 10% of our Asian population, and then even our Middle Eastern, I think that's Northern Africa, so that MENA that's there. And so we're taking some steps now via another grant opportunity to reach some of those other populations who English or Spanish is not their preferred language. So we are continuing that work this spring. Next slide, please. Or next graph. Thank you. So this was that question that I mentioned earlier. So what services or resources do you or your family need at this time due to COVID? We did have some questions that were pre-COVID, but this one was specific to that time period that we were asking in the fall. And you'll notice here that first option is, folks, some people said they didn't have any needs at all, and that was perfectly fine. And then as we mentioned earlier, food, cash, and PPE were the top three. And then clearly utilities and rent came very shortly thereafter. One of the things that I want to note here as well is we have a policy at Dell Med that we try not to ask a question that we don't have a resource for. So the reason why these particular things made it on the list of 14 options for people to choose is that we could point them to a resource, whether or not it was via 211 information, or we had some data from some of the council members who were collecting resources and providing us with those, and or anything that just came across our Dell Med email. So when we asked the question, if they asked for something, we connected them to that resource. And then if you'll click one more time, Kate, what we did in our analysis is actually combine some of these variables to get an idea of, folks who said they had needs and what it looked like, white versus non-white respondents. And you'll notice here, again, that very first column are those who didn't select anything at all. And that's the one area where the white only group was the highest. And remember, people could select more than one thing. So it's not that, one of these is really the predominant thing. Most people selected, if not three more things that they were having needs on. But just to be able to show you, again, going back to that first picture, which was about equity, those who have things and those who are going to need a little bit more. Next slide, and I think this was my second to last one. So now let's dive into a little bit of the qualitative data that we collected. We did have a couple of open-ended questions in our survey, and just wanted to read a couple of these out loud just to help people to understand what being sheltered in place meant for folks with regards to food access. So bullet one is some people don't have cars to drive to a location to pick up food, and many don't deliver in rural areas. So food access is the question, but the solution was cars. It was a transportation issue. And you'll notice that transportation was not even in the top 3 or even in the top 5 for needs. The next one says there needs to be more transportation options for seniors who do not have vehicles. Live alone, don't drive, have family, and pay up to 45% more for my groceries by having to use delivery services due to markups, delivery costs, and mandatory tipping. And I'm unable to get food banks on foot, and many distribution points are not on public transportation routes. The next one says the importance of affordable home delivery of fresh food and groceries for those of us who live alone, lack transportation, and are sheltering. Using food delivery services increases my grocery bill by between 20 and 50% due to markups, delivery charges, and required tips, depending on the frequency of use. Difficult on a fixed income that is nearly the poverty level. And the last one says it's difficult to get school meals, without transportation or childcare. Some families need food delivered to their homes. So we pull these out because they're all food related, but they also have that stream of transportation that's woven in between. And so when you think about, again, that initial picture, folks really aren't able to get what they need because of transportation. And then clearly, we did all experience some increased pricing by having food either come to our house or to do curbside or what have you. And those were costs that some folks just could not incur. I think this last slide for me here, before we open up for questions. As I mentioned, we did have several partners that helped us. And these were relationships that we already had going into the pandemic. So we prepped them as the city and, as we were meeting with the city to say, we're going to push out this survey. Would you be interested? Can you push this out? The two groupings are by the waves. So we sent it out to that first group in wave 1 and then the second group in wave 2. We didn't want to push it out to the same people again. There were a couple of folks who completed it twice and we didn't want to have duplicate data in the sample. So 40 partners here, but we also reached out to folks who, were in our social networks, individuals that are that we do some work with as well, and we're sure. Sorry about that. I'm not sure if you can see the screen. I can not, but essentially we reached out to individuals. I'll keep talking. Reached out to individuals to make sure that they were able to get a survey as well, and they could push it out into their neighborhoods and social networks as well. And I think that's all I have.
All right, thank you all so much, Amanda, Katie, and Casey. There are a couple questions already in the chat box, but I just wanted to ask more global questions. Since the title of our presentation is Breaking Down Silos, can y'all give really specific examples of how working together was better than this work was all working on our own? I mean, what was the advantage of breaking down the silos? And any of y'all can take it.
I'll jump in real quick. This again is Amanda from the city of Austin. And we were kind of lucky in that when COVID hit, we already had some strong relationships and had already sort of had this many opportunities to work kind of across large groups of stakeholders, and so those relationships were already formed, and so it wasn't so foreign to us, when COVID hit, like, oh, now we have to engage with external partners. What's that going to look like? But I do know that I had never been on focused and concentrated calls with just, Casey and Katie and Sandra and our colleagues Mariana and Edwin, just to kind of have these really deep dive discussions. So it was those opportunities of kind of this contract work and this specific focus that really let us kind of dive even deeper together to kind of understand each of the different perspectives, and I think just start to bring more questions to the table. And I think we all come at it from slightly different perspectives, and the opportunity to just sit down together once a week and share our perspectives, so much like floods out from that. And the project and the research kind of shape shift over the time period. Of course, we had our deliverables that we had to meet, but it was the collaboration of kind of getting there together was really helpful.
I'll also add that we also would not have had as great a survey without the School of Public Health. So the fact that the Fresh for Less work was underway allowed for us to review some of the questions that helped us to know that we probably should be asking some prior to COVID questions in addition to current COVID questions. We wanted to make sure that we were asking, demographic information. So there were some critical things that I think we would not have done as great a job at collecting the data, even though we knew how to push it out and we knew those methodologies. It really took kind of the village to put it all together. And I think even from the city's perspective, we had meetings with folks at Travis County, Austin Public Health, like we truly did. This wasn't just the three entities, just even here on this webinar. We truly tried to work together and really de-silo the work. And I'll say that's a good thing that came out of COVID. You know, I think the fact that Austin Public Health couldn't do this, the Office of Sustainability couldn't do this, they had to reach out. You know, we're here. So it's really just been a joy to collaborate and do this work together.
I'll also add, for my specific work, I think I got it, lots of components happened a lot quicker. If I was tasked with trying to aggregate all of this information about exactly what emergency food assets were located every month and which ones were open and closing and all of these things, and doing it myself or with our small team, it would have probably taken me twice as long to develop the report, instead of having kind of our various networks that we had relationships with kind of all coincide. So we had a larger network together to pull from. And I think it helped streamline that process so much. And it also helped disseminate findings from our various reports, because we all have our own networks, and being able to kind of each have our email blasts or our social media posts or whatever it may be from each of our different organizations, I think has been really helpful to help get our deliverables and our research into the hands of people that are able to utilize it and justify it for asking for more money for school feeding programs within a specific part of the county, or just different aspects that I think ultimately result in a larger impact than if this work was just kind of within its own little bubble. So I think that's been a huge strength as well.
Great, great answers. I'm going to go to one of the questions that one of our viewers has posted, because I think it goes back to what Amanda said earlier, just having a dedicated time where we sit together and talk and we go deeper into some of these issues. This is actually a question that we talked about this morning, so that's why I kind of want to bring it up. But the question is, why are people of color at a higher risk of getting COVID-19? And it's just, to me, so it's great to see that question, because again, we talked about that this morning in much detail. So I don't know who wants to start, but Casey, you had a lot to say about that.
I'll go. One of the things that we literally just had this conversation this morning. And it really, I think it just really starts with this kind of chronic stress. And I had an opportunity to sit in on a grand rounds that Michael Brode led last week that had several different physicians talking about how the virus attacks different organs in the body. And unfortunately, you know, due to just life, you know, I do feel like those of us in, you know, in the Black and Brown community, things are often a little bit harder for us to make ends meet. We also have to deal with, you know, structural barriers. Racism is one of those things, and stress does have impact on the body. So if you can imagine someone who is who has a lot of inflammation in their body just normally, they might even have hypertension or diabetes. Those organs are already compromised. You add now a virus that's trying to survive, and it's going to replicate wherever it can, and it goes everywhere from our brains to our feet. That's what I've been told. And so therefore, that virus, once it gets to that compromised organ, it doesn't know to let up, you know, and if the body can't fight, then that means that people decline pretty quickly. So again, just chronic stress is really kind of where it starts. And unfortunately, these aren't things we can change quickly, but it's a lifetime of worry, you know, and trying to provide. And the storm and COVID have not really allowed for that to let up for anyone. So I'll stop there.
Yeah, well said, Casey. I mean, I think that's why we all need to commit to anti-racist work. There's not too many things, too many negative outcomes in our communities that you won't find where Black and Brown people are disproportionately impacted. So, you know, when we talk about breaking down silos, I think we, as you know, as somebody who I'm a food policy advisor, but I cannot just look at food systems issues when I'm looking at how to do this work. I really have to consider the whole systems. So yeah, it's that systems approach and making sure that we're bringing an anti-racist lens to the work.
Well, thank y'all. So I have another question again. I think I'm going to push this to Amanda first. And I'm sorry, I did not forewarn you that I was going to ask this, but I'm just curious, what are next steps? Where do you see the city of Austin going from here? I mean, we've had, the pandemic, we've had the storm, both really, showed us where there's some weaknesses in our food system. There are weaknesses. And not just here, right? I mean, it's everywhere. It's in the United States. But where do you see the city or even Texas going from here in terms of creating a more resilient food system, trying to prevent some of this from happening again?
Yeah, I think that we definitely, like when we look at our emergency operations plan for the city and county, there's a little bit about food in there, but it's not a robust part of the plan. So we've had to kind of, build the ship while steering it or whatever. We are kind of, I don't feel like we were as well prepared for emergency responses we could have been and now will be. I mean, we have these experiences that hopefully, definitely break us down, but hopefully build us up stronger. And that sort of is the definition of resilience, right? Like to bounce back better, stronger, wiser, more well prepared for the next thing. Now, Uri just showed us that COVID didn't quite get us there. We weren't quite prepared for Uri either. So, in terms of like practical next steps, the city is doing a what they call a hot wash, or sort of a focused after action reflection on the food access and water distribution pieces of at least Winter Storm Uri response, and we'll be using that to inform the larger after action report that the city is working on. COVID hasn't quite ended, so we haven't entered that process yet for COVID. I think, practically we need an emergency operations plan where food distribution of food systems is deeply embedded and very clear. We need to keep building off this amazing network of individuals and organizations that we have become to know even better and more during our emergency response. And we are also looking at how we build that emergency, like disaster and emergency response plan, into kind of a larger, broader food plan for our community. So looking at not only Austin Travis County, but regionally, how do we fit in and communicate and work with our neighbors to make a really strong, resilient, and fair food system that works for everyone.
So Casey or Katie, y'all have anything you would like to add to this? I mean, I know this is very specific to the city, but what are some of your ideas about next steps related to food resiliency and food systems?
I'll just add that I have an opportunity to also sit on the food policy board, and to Amanda's point, and we are planning to go to the city just to share some recommendations that we have regarding that overall food policy plan. That should lead to emergency planning as well, but there are some specific things that we feel like need to be done. And that even ties into the last question. We've got to be measuring equity. We also have to be looking at things with an equity lens when we're talking about how to respond. And then the last thing that I'll just add is one thing that the Winter Storm Uri also provided us with is not just food, that we actually now have to start using the word water when we think about what it is that people need. And we just had an unfortunate event a couple of weeks ago where there was an apartment complex on the east side that after a month still did not have gas and water. And that's it's just ridiculous, really. But the notion that that wasn't something that people felt like was, when the water stopped, it never occurred to people that that was something that still needed to keep going. So we just have to continue to explore all of the pieces of the puzzle and ultimately, create some type of plan. And I think that that's even where the Michael and Susan Dell Center for Healthy Living comes in. You all do a lot of things around nutrition and a lot of things in schools, and the schools have played a huge role in making sure that families have meals, and even during the storm, there were some shifts that had to be made. And so there's got to be a broader plan that we get out of these situations and circumstances that we've been in.
I think the only thing that I would add is I think that all of this work has really illustrated how it's not just food that people are experiencing. There's a whole group of issues and competing interests that all cluster together around food insecurity. So yes, you might be having trouble putting food on your table, but you're also having trouble paying for your rent, paying for your utilities, finding childcare, paying for your car insurance, or being able to get a car, all of these different factors. And I think it really calls for more researchers to, when they're doing food insecurity work, to not just measure food insecurity and income and call it a day, but really looking at kind of a holistic approach to these factors that can contribute to that chronic stress that was talked about earlier too, because there's just so many factors at play. And I think greater nuance of how racism can contribute to this, how chronic stress, how all of these things build off of each other would really advance our understanding and also help understand what type of policies and practices would be the most beneficial to our communities.
Thank you. Great answer, Shel. There is one other question in the Q&A box. It's related to maps and where the major highways are, and just for reference. So I think what we will do, I mean, it's kind of hard to go back to the different slides, but we will be posting these slides on our website, and maybe we can just indicate where the highways are on the map. Is that possible, Katie?
It can be, but I'll have to go back. Honestly, the easiest way to put it is where a lot of those lines are, like where it goes from white to blue, that like main through line is where 35 is. Yep, perfect.
Yeah, maybe.
So I don't have control of the mouse, but you can kind of see where that main, yeah, perfect. Like that main through line is right where 35 is, for those who are familiar with the area, which also has a history of redlining practices and all of these other kind of remnants of systematic and structural racism over the years. So hopefully that's a little bit helpful.
Thank you. But before we close, do y'all have any last, I guess, comments about, again, the way we kind of all came together to collaborate, working together? Is there anything else you would like to say? I think we addressed a lot of the different aspects, but I'm giving y'all a chance for the last word.
I guess I'd just say that this is, the tip of the iceberg. I know that there is collaboration on the horizon. There's been some questions in the chat about, other for-profit entities or philanthropy, and how to leverage those folks, and there is so much room for that. We talk about that a lot, but I know that there's a lot of room to grow there in terms of how we collaborate. And yeah, I think, very committed to recognizing that no one entity is, certainly, local government is not going to save any of us or, make a community resilient, nor is the large university in your town. It's really, it's community that makes community resilient. And that's what we're working towards over at the City of Austin.
I'd just like to share that one thing I got flustered, my slides went away on my computer at the end. The reports that Katie and Sandra have created are on the Michael and Susan Dell website. So those are available. I think that was in the chat. And then the report that we did at Dell Medical will be available actually on the Office of Sustainability's website once it's been approved and can be posted there. So just wanted to let everybody know that we do have much more data to share for those who would be interested in getting that information. And then I'll also just add that this has really just been a joy to work with these ladies and gentlemen. Edwin's not here. He represents the male gender for us weekly, but truly working through some of these issues, talking about the data, figuring out kind of next steps. It's been a great partnership, and I honestly feel like it's one of the things that actually helped me get through the pandemic. Sitting at home and, we were never doing nothing, but this kind of gave us some purpose and allowed for us to not feel sorry for ourselves that we were sitting at home and still working, but it really gave us some focus. So I really appreciate, Amanda, you and Edwin reaching out, and Sandra and Katie, agreeing to do this work all together, and hopefully we can continue to do so.
Thank you, Casey. It's been great working with y'all. And I just realized there were more questions, and I just wasn't looking in the right place. So we're out of time now, but we can address these questions and email them to you. If that's all right. I'm sorry. I apologize if I didn't ignore anybody. I just wasn't looking at the right one. Just looking above, not below. All right. Well, I think that's close. Thank you, everybody, for joining us. And if y'all have any questions, here are all our addresses, email addresses, so you can always contact us. We'd be happy to answer any questions. We'll see y'all next time.
All right, thanks.